I'd like to ask you both permission to use this video for educational purpose and on the internet.
Yep.
Do you have your permission? Now, tell me about your pain before the surgery. How bad was it?
Well, I was terribly uncomfortable. I had to walk with a walker. I couldn't, I was falling. The month of October, I fell 10 times.
Before the surgery,
Before
yeah.
the surgery.
So you could barely walk.
I could barely walk.
And the
yes.
pain, how bad was it?
Well, I don't remember, because I don't have any pain now. It's hard for me to even remember or think. But my answer to you was about an 8 to
10.
8 out of 10.
Whenever you went to a doctor or the emergency room, you always said 10.
Oh,
So
yeah,
you, and you
I
did, yeah, and you did
Yeah.
go to emergency room
Several
because of the
times.
pain.
I forgot
One
about
time
that.
Yeah.
she said 15, and the gal said, "We don't have a 15."
Well, we call it 10 plus.
Yeah.
10 plus,
yeah.
yeah.
So
Yeah.
that pain was in the back and the legs,
Mostly in the back, that one
but
was.
some in the legs.
Some in the legs, yes.
How bad is your pain right now?
I don't have any pain.
So when did the leg pain go away? You remember when the, or maybe you can help as well.
Yeah,
Oh, I
probably.
still use it and I have a little few twinges, but it's
Yeah,
not
I would
pain.
say in the last 2 weeks, probably 2 weeks ago is when you really said, "I don't need pain medication anymore."
So, and we are only 3 months or 4 months after the surgery. And
Almost
that
four.
was not a small surgery at all. Here, this is what we did. We did a L2 to S1 correction of the scoliosis, and your spine is not side bending anymore. And look at that, all the screws are in perfect position. Here, these are the top screws, second screws, and practically every screws are good. Bone is growing in the front, but in the back, in the what we call facet, bone still has to work and grow. Here, there's still a gap there, but this is pretty good. So, and your pain actually practically is gone. Obviously, certain activity, certain position will still give you pain. Now, before the surgery, you were falling because you were weak in your legs, and that weakness is still there.
Yeah.
That weakness, as a matter of fact, right after the surgery, got a little worse, but
Worse.
we are going to work on that in the next year. Most of the time, statistically, we can recover most of it and get the patient more toward what we expect them to be normal. But overall, you know, this surgery was done in about 1.5 hours, and we lost half a cup of coffee of blood. That's all what we lost blood. Do you remember the surgery itself, or do you remember it?
I do, yes.
How many nights did you stay in the hospital?
4.
4 nights.
4 nights.
And that was because you know we had some problem with getting you out of bed and so on. Vast majority of my patients don't even stay that long in the hospital.
I couldn't, if I could have walked, I could have probably gone
Yeah,
right away.
yeah, but you know, again, you were weak before the surgery,
Right.
and it took us a little longer to, you know, ambulate you, and it's extremely important to ambulate you before you walk. And as well, your surgery wasn't a small surgery; it was a very big surgery with scoliosis correction and so on. The good news is that scoliosis is gone. Your pain is significantly better. Obviously, you have to continue physical therapy to get more function
Yeah.
and make you independent.
Yep,
Okay.
yep.
From your observation, her daily activity before surgery and now, like October to now, what do you notice? What jumps at you? What the difference?
Well, at first it was significantly different. You know, before surgery, she was still doing certain things, going into the kitchen, doing some cooking and so forth. Right after the surgery, of course, after she got home from Dove, so there was a Dove in there where
2 months.
we weren't home. But once she got home, then she started to do more things, more and more. And as of yesterday, she was doing quite a bit more in the way of cooking, and you know, then she'd have to sit down a little bit
Yeah.
for a while and rest.
Yeah, and we are just 4 months after this big surgery. So
Yeah.
this is 4 months is no time for this kind of surgery. So the activity is improving. That's what I hear.
In fact, the last physical therapy session, the gal took her down our basement stairs. And
Yeah.
back up. So
Well-
that was significant.
Excellent, excellent. Now we still have a long way to go, but I'm very happy with so far our improvement. Any other question or comment for me?
No, I just thank you for the pain being gone.
Yeah, and that is probably
Yeah,
for most
that
of
was
my
big.
patients. Yeah.
It was
Yeah.
almost magical because
Yeah.
it was so,
I had it
so
most
bad.
of my life, it feels like, you know,
Yeah.
back trouble.
But
Yeah.
now it's better. Now let's keep it that way by slowly improving the activity and increasing the amount of the activity. Thank you so much for the interview. I appreciate it.